Three, two, one. Okay. Hi, this is Kellen Polingyumptewa from the Hopi Cancer Support Services under the Hopi Women's Health Program. I am the program coordinator, and I'm here today to discuss the importance of preventative cancer screening. And we are we have a special guest here today to talk about the importance of preventive cancer screening. And this is all in honor of the Hopi Women's Health Week 2022. So we would like to welcome Waynette Taylor today. She is a physician assistant at the Hopi Healthcare Center. She serves as the provider liaison to the Hopi Cancer Support Services. She completed her master's degree in physician assistant studies at the Northern Arizona University. Prior to that, she earned her Bachelor of Science degree in biological sciences from Arizona State University. She is both Navajo and Hopi, grew up on the Navajo Nation. Welcome, Ms. Taylor.
Hello, thank you for having me.
So today we're going to discuss the preventative cancer screenings and the importance of why we do this, and specifically for females of all ages. And so I wanted to start the discussion today with you in regards to that. So before we start, let's get to know you a little bit more. So the first question is, how did you choose the profession you worked in today?
Great question. I wanted to become a physician assistant because of my particular interest in diabetes. Learning about diabetes and other disease states was challenging. It was important, and it was also interesting to me. It fueled, I would say, my competitive spirit and my eagerness to help other people. And I really wanted others to understand their disease states as well. I wanted to explain how their medications will help prevent complications. And honestly, it does continue to be the driving force for me today.
Well, that's awesome. We talk about this a lot locally as far as with our young ones going out and achieving the education, at different universities and bringing that knowledge back. And it sounds like you're doing that. You're living that. Coming back and helping our people out here in the Hopi Nation and as well as the greater Navajo Nation. So let's go ahead and talk a little bit more about women's health screenings. And so the first question is, what is a well woman exam?
Well woman exam, it's a visit with a caring and professional provider who asks questions about your menstrual cycle and medical history. The provider will assess your vital signs and perform a very brief physical exam. The physical exam can include a breast exam and a pelvic exam based on a woman's comfort level and their health concerns. A breast exam can assess for lumps or irregularities. A pelvic exam helps assess for early stages of cancer, sexually transmitted diseases, or any other causes of inflammation.
Great. And when should a woman schedule their well woman exam? Well, around what age would a woman expect to schedule that?
21 years of age.
Great. So when we talk about well woman exam, and as you explained, it's it is a very important coming of age process as far as in terms of screening. And what should a woman expect at their appointment when they do make this well woman exam?
In addition to what was briefly discussed above in the assessment of a patient's past medical history and a breast and or pelvic exam, they can also be offered screening tests for sexually transmitted infections and contraception. So it is a great resource for our women. It's a safe space for women to ask questions about their health.
Okay, great. And I know oftentimes we get asked this at our clinic on the Hopi Women's Health Program, but um, for those listening, what is a pap test?
The pap test, also known as a pap smear, it's part of the pelvic exam and it involves a speculum that a provider uses to look at the cervix and a brush to collect cells that the lab will look at for precancerous cells. This is a screening test to assess for cervical cancer. In women over the age of 30, we also perform an HPV test, which looks for high-risk strains of HPV that are associated with higher risk for cervical cancer. So routine screening has been shown to reduce the number of cervical cancer cases and deaths from the disease. So that's why it's so important to get screened.
Great. That sounds like a simple explanation. And one of the things that it accompanies this is a thing called STD screenings. And so, why do they do an STD screening, and what does that stand for? STD or STI screening?
So it stands for sexually transmitted diseases, STI, sexually transmitted infection. It's testing, and it includes HIV testing, syphilis, gonorrhea, chlamydia, and hepatitis C. It's offered almost every visit, especially during a well woman exam. It's highly encouraged. If you are sexually active, you should request to get tested for STIs. It also will be offered, and if it's offered and you are sexually active, you should get tested. It is recommended that all adults and adolescents from ages 13 to 64 be tested for HIV at least once. All sexually active women younger than 25 should be tested for gonorrhea and chlamydia every year. Sexually transmitted infections does increase risk for HIV.
Okay. And as they're getting tested, there is what you had informed us of is that there are some sexually transmitted infections, and one of them we often get alerted to is HPV. And so, what is HPV, and how is it related to cervical cancer?
Okay. Yeah, HPV infection, it is a viral infection and it causes skin or mucous membrane growths, also known as warts. Most HPV infections do not lead to cancer, but some types of genital HPV can cause cervical cancer. Other types of cancers, including anus, penis, vagina, vulva, and the back of the throat, have been linked to HPV infection. These infections are transmitted sexually or through skin-to-skin contact. Vaccines can help protect against strains of HPV, most likely to cause genital warts or cervical cancer. Nearly all cervical cancers are caused by HPV infection. This is, again, the reason routine screening is important.
Great. And thank you for those explanations on the well woman exam. I know that a lot of women, they hear all of these acronyms and all of these, all the letters of the alphabet, and it becomes confusing sometimes to understand what they truly mean and what the reasoning is behind all of these exams. But we're going to be switching topics to another cancer prevention screening. The Women's Health Program offers a mobile on-site mammography screening at their office in our Kikotsmovie, Arizona location. And so one of the things that we do offer is a mammogram. And so can you explain what that is for the listeners?
Yeah, just briefly, a mammogram is an X-ray picture of the breast, and it's used to look for early signs of breast cancer.
And when should a woman schedule their first mammogram? What would be a common age, and what are some of the age ranges regarding a mammogram?
Okay, well, we use just kind of generally the United States Preventative Services Task Force. They recommend women who are 50 to 75 years of age and are at average risk for breast cancer get a mammogram about every 2 years. Women who are 40 to 49 should talk to their doctors about when to start and how often. At the Hopi Healthcare Center, in collaboration with the Hopi Women's Health Program with the Hopi tribe, we recommend mammogram screenings at age 40, and we'll recommend them annually as part of prevention.
And thank you for the explanation on that, because you know, a lot of times we do get questions regarding mammograms, and there are two different types of mammograms that we see. They're not really as when we talk about this, we can say that they're not really different, but they're just a different type of mechanism on how to take a mammogram. But please explain to the listeners about what the difference is between a 2D mammogram and a 3D mammogram.
A 2D mammogram, it takes 2 pictures of each breast, often from the side and one from above, whereas a 3D mammogram takes multiple images of the breast from different angles and compiles them into a comprehensive 3D image of each breast.
So basically, the radiologist can manipulate the images in a 3D virtual space, right? And then they can see what that the size of a tumor or some type of area that they're looking at. And so that's really the advancement of the technology in as from the 2D to the 3D, and it gives from what I hear, it gives a better perspective of the location that they're looking at. So moving forward, what is the difference between a regular screening and diagnostic screening in a mammogram?
So a regular screening mammo, they're annual preventative exams. A provider may order a diagnostic mammo if the screening mammo is abnormal. A diagnostic mammogram provides a greater level of detail through additional images or views, including spot compression or spot compression with magnification, and can provide further insight into abnormalities detected during a screening. So these images, they can contribute to a more accurate diagnosis or assist with recommending additional diagnostic procedures like a biopsy or an ultrasound. The detailed image can also identify normal tissue. If an area like appears abnormal but is not cancerous, the radiology may recommend regular monitoring.
Great. And so when we talk about the mammograms and what we offer there, that in a nutshell, that's kind of what you know, the description is. And thank you, Ms. Taylor, for explaining that for us. The Hopi Women's Health Program is moving in a direction of providing equitable health care for people of all genders. So this is a question that speaks to a broader sense. And I would just like to ask you, why is it important for transgendered men to continue their preventative cancer screenings?
Yeah, love this. So if a transgender man still has breast tissue, they are still at risk for having breast cancer. Same for transgender men who have a cervix, they are still at risk of getting cervical cancer. Transgendered women without cervix do not need pap smears, but still need to talk to their providers if mammograms or other forms of preventative cancer screenings are indicated.
Great. So thank you again, Ms. Taylor, for participating in this brief discussion. I know, you know, these questions are something that, you know, the public do ask. And so I appreciate your responses. And the last thing I want to ask you is, you know, what is the importance of women's health cancer screenings, and why is it important?
Two of the most common cancers affecting women are breast and cervical cancer. So early detection is key, which is why screening tests are so important. So please talk to your provider or contact the Hopi Women's Health Program if you are interested in either breast or cervical cancer screening.
Again, thank you, Ms. Taylor, and I appreciate the discussion, and this will conclude our interview. If you would like to go out and search our services, we're under the Hopi Women's Health Program, and our number is 928-734-1151, and you can get more information on that program there. Thank you again.
Awesome. Thank you so much, Kellen.